So I'm going to do some IFC on Trey here. First we're going to do the pre-mod on his deltoid strain. So let me get, we're going to use 2 electrodes for that. So basically what IFC does, it's going to help with the pain. It's not going to help eradicate the source of the issue, but it's just going to help treat the issue basically. So it won't be curing anything today. We're just going to numb it a little bit so that you can go to practice. All right?
Sounds good.
Have you ever had stem before?
Yes.
Okay. If he hadn't had stem before, I would explain it to him and then possibly show it on myself if he was apprehensive. But first we're going to get our alcohol wipe and we're going to clean the area. So for pre-mod, I'm just going to do 2 electrodes, and it's his deltoid strain, so we're just going to do it right here. You always want to make sure the electrodes are of the same size as well whenever you're doing multiple. Okay. You always want to make sure it's turned off as well before you put it on them, because that would not be very fun. I checked it all before, so okay. Let's see. So you're just going to feel some little tingles, okay? Tell me when you start to feel it.
Feel it.
Okay, tell me when it's strong but comfortable. A little too strong. You don't want any crazy contractions. There you go. Is that good right there?
Mm-hmm.
So I would just let, we would do it for 20 to 30 minutes, however long he has time to do it. And then I would kind of show him how to do it, give him this so that he can adjust it on his own, and that's all. Afterwards, I would suggest him do some rehab, and then go to practice. I'm gonna turn it off. Okay. All right, next we're going to do some IFC quadpolar, however you say that, I'm not sure, on his AC joint here. So the same thing, it's just going to help treat the pain. It's not going to cure it. It's not going to solve the problem. It's just going to help us make it feel better so we can do some treatment, and then, or he can go to practice. I would also ask the patient, have you ever had stem before?
Yes.
He just had it too, so we know that he's had it before. So for the AC joint, for quadpolar, we're going to do 4 electrodes. We're going to do front and back, and then we're just going to like make an X across it. So. And then you want to make sure, so there's 2 different cords going on, so you want to make sure they're across. So this is one, we'll go here, and then the other ones will go there. You can just relax, I got it. Oh, I would clean him before as well, but I just put it on him earlier, so it's the same thing. Okay. So there's that AC joint, we're going to cross it right over it. And then, so that's one lead. When you take the next lead. Some of the things you don't want to do, if you have a patient who has a pacemaker, or you don't want to do it like right over his chest. If it's a super acute injury, wouldn't do it right away. This is more of like a past 48 hours type treatment. Okay, so then I'll let you get all comfortable. So same thing, tell me when it's strong but comfortable. Okay, so I'll have to turn up this one first, and then I'll do that one. Tell me when.
That's good.
Okay, and then the next one.
That's good.
Okay. So then same thing, I will let it run for 20 to 30 minutes. I would explain which lead is on which control here, since this one only has, it's not all on one setting. And then afterwards, I would have him do some rehab and some stretching and send him off to practice. And that's how you do IFC.